animals, people, and the environment are interconnected. If something affects the environment, it affects people and animals, as well as if something affects people or animals. Currently, many situations affect this interaction. Deforestation, land use transformation, and urbanization are causes of an increasing reduction of wildlife habitats. Also, the trade and consumption of wildlife, climate change, and other factors deteriorate human and animal health. So, contact between animals and humans becomes riskier and increases the probability of transmission of pathogens between species, generating risk for new diseases. Zoonotic diseases are spread between animals and people. Harmful germs like viruses, bacteria, parasites, and fungi cause this. Rabies, avian influenza, and now COVID-19 are some examples. Around 60% of all emerging human infection diseases are assigned to zoonotic origins, most of which originate in wildlife. So, it is urgent to address this problem. But, what do we know about this topic? How is the perceived risk regarding disease emergency from the human-wildlife interactions? What practice do we have that can damage this relationship? What do we do to benefit human, environmental, and animal health? Are we willing to seek solutions? The project Knowledge, Attitude, and Practices Towards the Risk of Zoonotic Diseases, Wildlife Trade, and Wildlife Consumption in Latin America seeks to answer this question and find some joint solution in 4 countries of the region: Guatemala, Bolivia, Chile, and Brazil. For this, we have proposed 5 work packages. Work Package 1: Quantitative Baseline Assessment. This package involves an initial approach to the communities to obtain baseline information about knowledge, beliefs, perception, and experiences related to the risk of zoonotic diseases, wildlife trade, and consumption. We will analyze differences and common grounds among people living in urban, rural, and indigenous communities. Work Package 2: Qualitative Component. The second package collects and analyzes qualitative information through key stakeholder interviews and focus group discussions. The main outcomes are explore certain groups' vision and position on the subject and their experiences and perception on zoonotic diseases, wildlife trade, and consumption. We will also analyze barriers and facilitators for implementing intervention strategies in the communities. Work Package 3: Participatory Community-Based Action. Based on the knowledge of the previous package, a participatory community-based work is proposed to jointly address the problems identified. For this, community representatives and interested groups will work together with a multidisciplinary and intersectoral team. We will prepare a concrete plan on how to improve practices and intersectoral efforts towards wildlife conservation and health programs in the communities. Work Package 4: Pilot Intervention. As part of the previously developed plan, we will develop tailor-made educational intervention to be piloted. The training material will be developed according to the needs and availability of local resources. Work Package 5: Dissemination. The last package aims at project dissemination at different levels. On the one hand, the methods and results of the project will be shared with the scientific community and members of the Alliance. On the other hand, dissemination activities of the project will target the general population, organization, activists, policymakers, and other interested groups. There is a need for greater democratic spaces for the meaningful participation of the local population in national and international decision-making on nature conservation. It should consider local priorities and collaborative actions between communities, government, and the private sector. In a joint effort, we will seek solutions appropriate to the local context to preserve health and coexistence between animals, humans, and the environment.